is ready to blow me down.
You're nervous. You're sweaty. Your anxiety is through the roof. But stay calm.
What's up, guys? Welcome back to your channel.
We have a super special nursing in a nutshell topic. The biggest one yet.
NCLEX.
Yeah.
So, if you haven't already kind of assumed, NCLEX is a very stressful process. It gets you so overwhelmed and you get so much anxiety from it, just even thinking about it. So, we want to make this video to give a little bit of insight and tips of how we handled it.
And how you should handle it.
Right.
Because it works for a lot of people. You just gotta listen and go with it.
Mm-hmm.
That's what we can tell you. But even before that, here's one of the mistakes you shouldn't do. You know when you send in your paperwork, you finish everything, you make sure everything's good.
Mm-hmm.
You get like this mail that comes in, and it tells you like, oh, you can sign up, blah, 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 like on the website for your test date. I made the mistake when I got that mail. I was like, oh, so I'll wait for another mail. That's how I interpreted it. Like I'll be receiving another letter saying I can log in. So like a month went by, and I was like, everybody else has been getting this mail and signing up for the test, but I completed at the same time. Maybe I should look at it too. So I went onto the website to set up my test date. So I found out that as soon as I had the letter, I could have scheduled my test. So I messed up right there.
So, more of the story, if you get your letter, set up the date for your test instantly.
Set it up right away, because that
Tip
letter...
number one, the more you wait, the harder it gets. Why?
Why?
Because right after you finish, and let's say you're done with your courses and you need to take your NCLEX, all the information is still really fresh in your mind. And you're faster to think, whether you think about it or not, or you believe it or not. Your test taking skills are so much quicker.
Yeah.
And you're able to kind of like pinpoint which one is right and which one is wrong. So right off the bat, you should schedule your test. Even if it's super scary and you feel like you're not ready, believe me, you are.
Yeah, you gotta go for it.
And that's the prime time to be ready for it.
Because a lot of the students, they fear like that they're not prepared, and it's a lot of money. Yes, it's a lot of money for the whole application and the process, but it's a lot more money that you're wasting by not taking it earlier also.
Think about it. The longer you take of taking the test in that time, you could probably be working already. So you don't want to be wasting that time.
You don't want to be. You don't want to be one of those. You got to get on the ball.
Yeah.
So what is number 2?
So I want to start by going into what you should do to prepare yourselves, because you do need to prepare yourself so you don't forget information or your skills or how to be quick. So a lot of people use UWorld. And Ryan used it.
Yeah, I think we're big supporters of UWorld.
I personally never used it.
Because she's super smart.
No, because
she didn't need any study tools.
I used...
whatever she says, don't believe her, because she just knew everything already.
You just made me blindsided. What did I use?
ATI.
ATI. That's what I use. But he used UWorld.
But I think if you don't have access to ATI, I think UWorld gives you maybe a month subscription. They have different plans. And I think the pros of UWorld is it's the tit for tat. There's this phrase. It's exactly the layout of the NCLEX. When you walk in there, not even walking in there, but when you're sitting down and you're taking the test, the format of the questions and also how the questions look on the screen, it's exactly UWorld. So it gave me the comfortability when I was scared and nervous about taking the test. But when I sat down to take the questions, the format of the whole website looked exactly like UWorld. So they make it more friendly so that maybe you're a little bit less anxious when you're going into it, not knowing how it might look. It's kind of like the same.
So you should definitely, have UWorld or have like some other different method of testing yourself continuously so you can get comfortable with the questions, because there might be similar questions on the NCLEX. Obviously they're worded differently, but they're basically the same way. So yeah, for him it was UWorld, for me it was ATI. ATI wasn't the same layout, but it did give you a lot of questions for every system, because you need to test yourself for every single system, because you never know. So let's back up. How NCLEX works is you're going to be tested with every system, generally. And if you get the right answer for, let's say, farm, first question, they won't test you again for farm. They'll go to the next system and then the next system and so on. But if you didn't answer it right, okay, they'll give you another farm question. You didn't answer that one right, they're going to keep throwing farm questions until you get it right. And then you move on to the next one. So the computer works where it keeps giving you tries to see if you get it. So you can keep moving on.
And I think the stigma around it is that, if I go past 200 questions, I'm going to fail. Or if I get 85 questions, I pass. But do not take... The problem is you guys go into it with all this information. Like, oh man.
The number-wise.
Yeah, the numbers... Or how what Liz was saying, like the format, like, I'm going to get thrown another one. But when you're in there and you're taking the questions, don't think about it in your head like, oh my God, this is another farm question.
Like I'm in 205 and I'm still like...
Yeah. Or they repeat another farm question. Don't take it as, I'm
God,
doing bad,
failed.
like I'm getting another farm question, because a lot of the layout is... It doesn't matter what number you're at, and it also doesn't matter how many questions you're going to get or what type of questions, because in the end, if you're just doing it how you know what you're doing and whatever, like you trust yourself, most of the time you're going to pass. It's the fact that you're bringing in that anxiety and the stress contemplating what you heard about the test and then bringing it in the test. Don't think of it like that.
Right, because everybody goes through it differently.
Yeah.
Some people end their test in the middle, some people till the end, some people early. Like, it all depends on how your test taking skills are. Like, it's okay. At the end of the day, the goal is to pass.
Yeah, and everyone doesn't get the same set of questions, so you can't ask somebody like,
what did you get?
Yeah, what kind of questions you got? You got to go into it with the general idea that most of the questions are going to be different, but more towards like,
for example,
easy situations.
I never got maternity, and a lot of other people got it, but I never got it. I mainly got farm. I got
a lot of fundamentals. I think everyone gets a certain amount of fundamental question, no matter what.
But and I got a lot of questions like delegating questions.
Delegating is number one, but take it straightforward. It's what you would do as a nurse.
Right. So basically, studying wise, you should really know what your role is and what your scope of practice goes, because they will ask you, what's the role for an RN? They won't specifically ask you like that, but they'll give you scenarios, and you have to be like, oh no, like I can't do that. An RN can do that. So really know your scope of practice, because a lot of delegating questions are going to be there. But again, overall, NCLEX wants to know if you're a safe nurse. So it will give you different scenarios of what to do. Like, for example, if a person has right side weakness and is using a cane and wants to go up the stairs, how would you help them? Those type of questions.
That is a great question.
Or like, fire safety questions in case of an emergency.
Safety
triaging.
is number one in NCLEX. Safety, and they really challenge
infection
you. Infection
control too. That's another huge one.
Those are big.
If there's a blood spill on the floor, what should you use to, decontaminate it? Like, those are basic questions, but very important. So they want to know you know what to do in that situation.
And although we say that the tests are going to be different, majority is going to be focused on delegation, like safety, and those kind of things. You're not going to get a lot of questions that dive into a specific disease. Like the hard, deep questions that you used to take tests on chapters, you're not going to get those. because they don't,
it would
you
be
know,
generalized.
generalized types of things like
Yeah.
symptoms of a certain infection, but it's like more of like a broad.
Mm-hmm.
It doesn't go into like, oh, what is Kawasaki's disease? The things that we learned in there, you know, it won't get that deep. So when you look at the surface, if you position yourself to study a little bit of like pharmacology,
A little bit of everything.
yeah, nursing diagnosis or nursing fundamentals and things like that, the questions that dive deep, let's say maybe one or two, that's only one or two out of your test.
Mm-hmm.
If you know more towards your delegation, fundamentals, safety, you're gonna pass.
Right, and then
You take your losses where you think, you know, it's not gonna be there, you know.
And other questions they could possibly ask. They asked me was how to properly put on your PPDs.
PPE.
PPE, sorry.
PPD. PPD, right there.
They asked me that. So they're general questions like that.
Yeah.
That, again, they just want to know you're a safe nurse. Also, another little tip that I found out during my time, I don't know if it's still happening, but for each question, you have a lot to select, all that apply.
Oh yeah.
You will rarely have multiple choice. And the trick is, let's say you got a question right. The next question, it's select out of the apply. And it keeps going. But then all of a sudden you got a question you're not like super, like you think you got it wrong. And let's say you did get it wrong. You're going to go to multiple choice because you got it wrong.
Mm-hmm.
And then you get the next one right. You go back to select all that apply. So you kind of know you're at a good streak when you get a lot of select all that apply, which everybody hates them. They absolutely suck, but you're gonna get a lot of them, mostly all of them.
But don't take that in the test and kinda
Don't
change your
think about
mindset.
it too much though,
Because
Just-
sometimes it goes where you could have single answer choices, but you're still getting them right. So it kind of flip flops, but don't
just keep it in
yeah,
mind
Yeah,
a little bit.
don't take it in there and be like, oh man, be super confident and be like, I'm doing good right now, you know. And don't be too high, don't be too low. Just take the questions per question.
Right, and if you're stuck with a question, move on.
It's better to move on.
Yeah, don't stay so stuck on it because you're gonna burn your brain out because
Yeah.
you have so much more to go through.
I went in there, you know, she answered all those questions. She finished in like an hour.
It doesn't matter.
No, she finished in like an hour. Like what? How many questions?
I don't even know.
85.
It
I
doesn't
don't
even matter.
I finished at 85. She finished at 85, but I took longer. But I went like, if I didn't know the question in a minute, I was like, I can't be here. I gotta go. So I was like, eeny, meeny, miny. What sounds the best? I got this one. Let's go. Because you're gonna waste so much time, and then, yes, you have a lot of time. You have like 6 hours. But the more time you take on this question, the much harder
The more
next.
time in general you take in there, the less probability you might pass.
Yeah.
Not to say don't take your time, but just don't linger on a question for
Mm-hmm.
so long.
And how about the last thing we touched on? We touched on tips on what to do during the test, what to do before the test. But here it is when you go schedule your appointment and you're going in there.
Yeah, so let's
So
show
let's
you how it feels.
de-stress you guys. You know what I mean?
You want to say your story?
Oh yeah. So this is how it went
And
for
then
me.
I'll say mine. Because mine was a little stressful.
So she was with me when we had to go. So what we did was I had mine in Pasadena. And we arrived probably like an hour and a half before.
Oh, sorry to interrupt you. Don't study the day of. You studied so much
Don't even
for
study
it.
the couple of days. 'Cause
No, don't study
Oh.
like yeah.
Not even the
2
day
days.
before though.
2 days. Just
Yeah.
stop. Enjoy
Yeah,
yourself. Keep a fresh. You need your mind needs to be so
Yeah.
fresh.
You
for
can't
that
just
test.
shove yourself with questions and
Yeah,
questions.
before.
It's not gonna work.
That's the worst thing you can
Yeah.
do. Do not do that. But yeah, continue.
So the story was we got there an hour and a half earlier to scope out the place because I've never been there. Because one of the things of anxiety is you don't know, you've never been to the building.
You don't know what to expect.
You don't even know any part of where you're going to be. So you don't want to be late. That's one. You want to get there early. We went there, we parked, we kind of had a feeling for the place. Like we actually,
I told him
Yeah.
what to kind of expect.
we stepped down, we walked actually to the building to get a feel for it.
Mm-hmm.
And then we decided, okay, let's go back to the car and just,
Let's get some coffee.
Yeah.
Let's get some bagels. And
you know, just kind of relax and get into this mode.
Mm-hmm.
And I was freaking out, you know, I was going like, oh, I couldn't move, you know. But once you get in there, so she was in the car and I went inside.
Unfortunately, they were like, no,
Yeah.
you can't be there.
Yeah.
I was like, ugh.
But it's not as like scary as some stories you hear, like, oh, they pat you down and there's security there. It's not really like that. It's just there's a person in the front desk, ask you for your name, your ID, any kind of belongings you have, you just put in the locker. They're very nice, very cordial. Oh, well, my experience. So then when you're ready to take your test, you basically, well, in this facility, you walk in, a person just asks you like, do you want a pencil? Do you want those little, what are those, earplugs?
Mm-hmm.
Earplugs. And, you know, kind of make sure you don't have anything. And then there's like a control room right there. So once you get inside the door, that person takes you into your seat. And then they basically have cameras kind of watching you if you like look for something or you kind of cheat.
Everywhere.
Yeah, or whatever. But it wasn't as stressful as the stories you hear,
Yeah.
you know? But that's my experience. Kind of want to defunk that. Let's go with yours.
Mine was a little different. So I took mine in Culver City, and I took mine before him. So I went in there by myself, and then they directed me where to go. I went in. I had to sign up my name and everything, and because where I took it, it wasn't just for NCLEX. Other people were taking different types of tests.
Mm-hmm.
So I went in there. I put the reason why I had to wait. I put all my stuff in the locker, because when you go in, it's like a little office. There's a receptionist in the middle. There's lockers on the side, and then seats in the middle when you just wait. Then they call your name. So they called my name. They gave me a letter C, basically which section I was gonna go take my test. So then they told me to wait. So I was waiting, and they finally called the letter C. So I went in there, and then I had no idea where to go, because when I went in there, it was so confusing. There was letter C, but there was two different lines, and then there was a letter B and A, and it was kind of like not really organized. So I just went in, and I just kind of wanted to kind of ask where to go. So I went in the line, and then suddenly this woman came out, and she was like, why are you cutting? Can you not see where the line is? And I was like, I'm not cutting. I just didn't really know where to go. And she said, well, don't you see this line of people? You're supposed to be on the back. And it just threw me off, and my mindset and everything, and being so positive, that just pissed me off. So whatever. So I gave her the letter. And I just went to the back seat. The back of the line. And I was just so mad, and it just threw I just got in a bad funk. I was in a mood where I was like, you know what? I don't even care how I do. I just want to get this over with. But then this person in front of me was like, so what test are you going to take? And I was like, oh, I'm just going to take the LVN NCLEX. And she was going to take the RN. And she was like, don't worry, you're going to do good. You're going to pass. And for some reason, that just made me feel really good. I was like, yeah, you know what? I'm going to pass.
Mm-hmm.
So I went in.
And she killed it.
And I passed. And they gave me the same as him, a little board and a pencil.
Yeah.
Yeah.
But, so with her experience and my experience,
A little different.
go in there, make sure everything is correct and ready,
Mm-hmm.
so you don't have anything in your way or getting in a bad mood.
Oh, but they did pat me down.
They
And
pat
it
you
was the
down?
same lady. Maybe because she just didn't like me.
Yeah.
But she kept patting me down. I already gave her all of mine because I had a lot of bracelets. And I didn't know you were supposed to take them off. So I gave her my bracelets. I didn't put them in the locker.
Mm-hmm.
And then she still kept patting me down. She was almost going to go like, just really in there, like trying to find something. I was like, lady, I have nothing. But for me, it was a clear window where you can see inside what you're doing and
Yeah.
all the cameras and stuff.
Yeah. So hopefully that kind of de-stresses you guys.
If that happens to you, try to calm down. Like if someone says a bad comment to
Yeah.
you, it just ruins your whole mood and everything.
'Cause,
Just try to
yeah.
recollect yourself and come back.
Because
And-
generally it's not as scary as what people say.
yeah.
There's no security guard. There's no people being like, look, come through, let's pat you down, like for like as security. You know?
Mm-hmm.
So hopefully that helps you guys with the whole process from before, during, and end.
Just trust yourself. Don't second guess questions
Mm-hmm.
or your answers. And if you don't know the answer, just move on. Go to the next one.
And for those of
Don't
you,
stay stuck.
And for those of you, after you take the test, if you want to feel a little risky,
Oh, yeah.
there's a way to go to the website.
There's
Breeze,
a way to find out
yeah,
if you passed or not before.
by using your credit card.
They even tell you.
Yeah.
So, because I figured that out with my school, because we did that with my school.
Mm-hmm.
So for him, I did the same thing. We went online to apply again.
And we did it the day of.
Yeah, the day of.
I was so scared, but we're like, all right, we have to do it. You know where we were at?
Mm-hmm.
We're at a Starbucks. We're at a Starbucks to look. You just put in your information,
Mm-hmm.
and if it says that there's
It
already,
cannot
it cannot be processed because there's
processed.
already a file there,
It means
that means you passed. So you don't have to wait like
what
a week
sucks
or two.
though, if you don't pass, you basically already paid for it.
Yeah.
But
so
I
that-
mean-
you know, you got to be confident. You got to know that you passed. And
That's a trick though, if you want to know beforehand.
and let me tell you, all
Don't take it 100% because maybe it's different, but
it was really recent.
it works
though.
all the time.
It works all the time. So that's a tip.
If you don't want to wait.
Hopefully, all those things help you guys. We're rooting for you.
Good luck,
You guys got this.
future nurses.
Best of luck, future
Blah, blah.
future nurses. We'll see you guys out in the medical field. Ooh. Ow. Thank you for watching. This is Life
with L&R.